In the U.S., atrial fibrillation affects over 5 million adults, a number expected to rise to 12 million by 2030. It's a complex cardiac arrhythmia that disrupts the heart's normal rhythm and increases the risk of blood clots. But treating AFib isn't as simple as fixing a faulty wire. The heart isn't just a pump. It's a complex electrical organ with each of its cells responding to electrical signals that must fire in perfect synchrony.
Our lab has been interested in understanding the mechanism and how we can treat cardiac arrhythmia, which is abnormal heart rhythm, and sudden cardiac death, which can stem from multiple causes.
Dr. Nipavan Chiamvimonvat is a cardiologist and chair of basic medical sciences at the University of Arizona College of Medicine, Phoenix. Her lab focuses on uncovering the mechanisms behind arrhythmias like atrial fibrillation and identifying ways to intervene early.
One of the abnormal heart rhythm that we've been very interested in is what we call atrial fibrillation. And it is a chaotic rhythm in the heart that then precipitates clot formation and also can cause a heart failure.
Atrial fibrillation begins when the heart's electrical system misfires. Dr. Chiamvimonvat's research aims to pinpoint the molecular triggers behind these erratic signals.
We have actually identified several important targets, including a new protein that may be linked to this arrhythmia or abnormal heart rhythm. We have also developed, in collaboration with several investigators in the field, to identify a new small molecule that can help to reduce inflammation that is linked to this abnormal heart rhythm.
Inflammation is one of the hidden drivers of cardiac dysfunction. If that process can be interrupted at the cellular level, it opens the door for new kinds of therapies, ones that prevent, rather than just treat, the potential deadly effects of arrhythmia. But to get there, scientists first have to understand how heart cells communicate with one another, how millions of them stay in sync, beat after beat, year after year.
Each cell in the heart have to talk to one another and tell one another to beat in the synchronized fashion. That is what we are very fascinated about in terms of how we can bring the knowledge from the basic science to translate it into the prevention and treatment for heart disease.
By investigating the heart's cellular mechanisms, she is working to close the gap between basic science and bedside treatment.
The knowledge gained from their research training help to ensure that we provide the best clinical care to our patient, from the prevention all the way to treatment.
Solving the puzzle of arrhythmia isn't just about understanding biology. It's about building better care from the cellular level up. And that work is happening now, in labs like this one.